Hello everyone, my name is Victoria Armstrong, and today I'll be discussing the career of clinical psychology with you guys. The reason I chose the career of clinical psychology is due to my interest of the human characteristics of the mind and how it works. My interview took place at the Heritage Inn. My interviewee's name was Shamika Lee. She is a licensed psychologist who attended Georgia Southern University. Shamika Lee works closely with her patients. She works with monitoring and treating them daily, or she meets with them weekly to discuss different things. Her patients severity levels can range up to schizophrenia and a bipolar disorder. Clinical psychologists do not prescribe medicine. Instead, they treat their patients through psychological techniques such as cognitive behavioral therapy and psychoanalytic therapy. Or in other words, meeting to discuss like your issues and what's going on and how it affects you and what we can do to get you through it, stuff like that. Um, I guess how you treat the patient would depend on the severity. Like if I'm schizophrenic, I would try to find things like to tell them, like, it's not there, or what's real and what's not real, that kind of thing. With a bipolar disorder, because it's like on and off, you would want them to deal with their issues. Like if they was to get depressed, you want them to find things that make them happy, such as their kids or their husband, or the park, doing things to build their moods instead of keeping themselves down. Um, it's easy to confuse a psychologist with a psychiatrist. The difference would be that a psychiatrist, um, they do have their doctorates, but it's a medical doctorate, and they prescribe the medicine. That's the reason why psychologists cannot prescribe the medicine, because they don't have a medical doctorate. They only have their doctorates. So it just limits their ability. A clinical psychologist must have a master's degree before they can enter into the field of clinical psychology. They earn a average of $70,000 a year, which is not much. So you have to find, I guess, a way to make yourself happy through that career. So it's kind of shaky. Yeah. They can work in settings such as universities, the hospitals, schools, elementary. Um, but most of them have like their own private practices, so you wouldn't really find them too big on the hospitals and things. I believe the top jobs was the private practices and the schools. I think I would be more so interested in like a medical kind of thing, like maybe a hospital, something like that. Not too much of a school thing. The field of psychology or of a clinical psychologist is really competitive, so you have to basically earn your spot. You have to continue to get your education. The higher the education, the better the opportunity. If you stop at your master's, you really won't get much. But if you continue to go through your doctorates, you have a better chance of getting patients and stuff like that, and people taking you more serious, I believe. I'm definitely still interested in a career after going through all that and reading on everything. My personality, I'm more of a talkative person, so I believe it fits me. And my interest with dealing with the mind is still there. I like to know how people think and how they perceive things and why they perceive things this way. So I don't think it'll be changing anytime soon. But thank you guys for listening. That is my closing on the career of a clinical psychologist. And good night.